Question 1. A 45-year-old male with confirmed HIV infection presents with pneumocystis carinii pneumonia, PCP. I. B20J17. B. B20J18-9. C. B20 B59. D. Z21 B59. Answer C. B20 B59. This question tests your understanding of coding HIV with related conditions. The key clue is confirmed HIV infection presenting with a specific opportunistic infection, pneumocystis carinii pneumonia, PCP. When a patient has HIV and an associated condition, the B20 code for HIV disease is always sequenced first, followed by the code for the opportunistic infection. B59 is the correct code for pneumocystis carinii pneumonia, making the sequence B20 B59. Here's an easy way to remember. HIV always takes primary importance when the patient is symptomatic, so B20 always comes first when an HIV-related condition is present. Question 2. A patient is admitted with severe sepsis due to a urinary tract infection, UTI, and develops acute kidney failure. I. A 41-9 and 39-0 are 65, 21, and 17-9. B. And 39-0. A 41-9 are 65, 20, and 17-9. C. A 41-9 are 65, 21, and 39-0 and 17-9. D. Are 65, 21, and 39-0, A 41-9 and 17-9. Answer C. A 41-9 are 65, 21, and 39-0 and 17-9. This question evaluates your knowledge of coding sepsis, severe sepsis, and associated organ dysfunction. The critical concept here is that severe sepsis requires codes for both the underlying sepsis, A41-9 for unspecified sepsis, the severe sepsis code, R65-21 for severe sepsis with septic shock, and then the localized infection, and 39-0 for UTI, followed by any associated organ dysfunctions, and 17-9 for acute kidney failure. According to coding guidelines, the systemic infection codes, sepsis, is sequenced first, followed by the code for severe sepsis with or without shock, then the localized infection, and finally the manifestation of organ dysfunction. Remember to prioritize the sepsis and severe sepsis codes when the documentation supports them. Question 3. A patient is seen for a follow-up visit for latent tuberculosis B infection. I. A 15-9. B. Z22-81. C. B99. D. Z21. Answer B. Z22-81. This question tests the distinction between active tuberculosis and latent tuberculosis infection. The keyword latent is crucial, indicating that the patient has been infected with the TB bacteria but does not have active disease and is not symptomatic or contagious. Code Z22-81 specifically identifies a carrier of infectious disease, in this case, latent tuberculosis infection. Active TB would be coded with A15, A19, and sequelae of TB would be B99. Always remember that latent means present but not active, requiring a carrier or screening code, not an active disease code. Question 4. A patient presents with shingles, herpes zoster, of the left arm. I. B029. B. B0221. C. B009. D. B029. G530. Answer B. B0221. This question assesses your ability to code specific herpes zoster infections. Shingles is another name for herpes zoster, and the key clue is left arm, indicating a specific site. B0221 is the correct code for herpes zoster with left upper limb complication, which encompasses the arm. If the site were unspecified, B029 might be used. Remember to always seek the most specific code available in ICD-10-CM, including laterality and specific anatomical sites when documented. Question 5. A patient is admitted with septic shock due to Escherichia coli E. coli sepsis. I. A 41, 51, R 65, 21. B. R 65, 21, A 41, 51. C. A 41, 51, R 65, 20. D. R 65, 20, A 41, 51. Answer I. A 41, 51, R 65, 21. This question focuses on the correct sequencing for septic shock when the causative organism is known. The keywords septic shock and Escherichia coli sepsis tell you that the patient has a specific type of sepsis with associated shock. According to coding guidelines, when a patient has sepsis and septic shock, the code for the systemic infection, in this case, A4151 for sepsis due to E. coli, is sequenced first, followed by R6521 for severe sepsis with septic shock. R6520 is for severe sepsis without septic shock. Always prioritize the code for the underlying sepsis, then the septic shock. Question 6. A newborn baby tests positive for HIV, transmitted from the mother during birth. The baby shows no symptoms of HIV. I. B20. B. Z21. C. P002. D. P002. Z21. Answer D. P002. Z21. This question tests your understanding of coding HIV in newborns, particularly when transmitted maternally. The crucial information is newborn baby, tests positive for HIV, transmitted from the mother, and no symptoms of HIV. For newborns confirmed to have HIV infection from the mother but who are currently asymptomatic, code P002, newborn affected by maternal infectious and parasitic diseases, is sequenced first to indicate the maternal transmission, followed by Z21, asymptomatic human immunodeficiency virus, HIV infection status. B20 is reserved for symptomatic HIV disease. Remember that for newborns, even if confirmed HIV positive, if asymptomatic, Z21 is used, and the P002 code highlights the maternal origin. Question 7. A patient presents with a history of poliomyelitis from childhood, now experiencing post-polio syndrome. I. B91, G14. B. G14, B91. C. B91. D. G14. Answer B. G14, B91. This question assesses the coding of sequelae and current manifestations of a past infectious disease. The key terms are history of poliomyelitis from childhood and now experiencing post-polio syndrome. Post-polio syndrome, G14, is a current neurological condition that develops years after the initial poliovirus infection. B91 is the code for sequelae of poliomyelitis. According to coding guidelines, when a current condition is a manifestation of a sequela, the current condition is sequenced first, followed by the sequela code. Therefore, G14, post-polio syndrome, comes before B91, sequelae of poliomyelitis. Think of it this way: the patient is seeking treatment for the post-polio syndrome today, which is directly linked to the sequelae of poliomyelitis. Question 8. A patient is admitted for prophylactic vaccination against influenza. I. Z23, 5. B. J11, 1. C. Z20, 89. D. Z23, 9. Answer I. Z23, 5. This question tests your knowledge of coding for vaccinations. The keyword prophylactic vaccination clearly indicates that the patient is receiving an immunization to prevent a disease, not being treated for an active infection or exposure. Z23, 5 is the specific code for encounter for immunization against influenza. Z23, 9 is a more general code for other unspecified immunizations, and J11, 1 would be for influenza with a specific manifestation, which is not the case here. When coding immunizations, always look for the specific Z code that describes the type of immunization being administered. Question 9. A patient is diagnosed with candidiasis of the skin and nails. I. B37, 2. B. B37, 2. B37, 5. C. B37 9. D. B37 2. B37 3. Answer D. B37 2. B37 3. This question assesses how to code multiple sites of a fungal infection. The keywords are candidiasis, which is a type of fungal infection, and skin and nails, indicating two distinct locations. B37-2 is candidiasis of the skin, and B37-3 is candidiasis of the nails. It is appropriate to report both codes to fully capture the patient's condition when multiple distinct sites are documented. Remember that if specific sites are mentioned, you should code to the highest level of specificity for each affected area, rather than using a general unspecified code. Question 10. A patient presents with chronic hepatitis B with delta agent. I. B18 1. B. B18 0. C. B16 9. D. B17 0. Answer B. B18 0. This question tests your ability to identify and correctly code specific types of viral hepatitis. The key information is chronic hepatitis B and with delta agent. Hepatitis B with delta agent is a specific co-infection. B18-0 specifically codes for chronic viral hepatitis B with delta agent. B18-1 is for chronic viral hepatitis B without delta agent, and B16-9 is for acute hepatitis B. Always pay close attention to the specific type of hepatitis and any co-infections or agents mentioned in the documentation for accurate coding. Question 11. A patient is treated for Streptococcus pneumoniae pneumonia. I. J18 1. B. A 43. J18 1. C. A 49 1. J18 1. D. A 43. Answer C. A 49 1. J18 1. This question assesses how to code bacterial infections causing conditions classified in other chapters. The keywords are Streptococcus pneumoniae, the infectious organism, and pneumonia, the manifestation. When the infectious organism is known and the resulting condition is classified in another chapter, like pneumonia in Chapter 10, the infection code is typically sequenced first, followed by the condition code. A 49-1 represents streptococcal infection, unspecified site, and J18-1 represents pneumonia due to Streptococcus pneumoniae. While J18-1 itself specifies the organism, current guidelines often support coding the underlying bacterial infection first when it's clearly the etiology of a condition coded elsewhere. Remember to look for codes that specifically identify both the organism and the resulting disease, often requiring two codes when the disease is not exclusively categorized in Chapter 1. Question 12. A patient is screened for methicillin-resistant Staphylococcus aureus, MRSA, colonization, and the test result is positive. The patient does not have an active infection. I. A 49-02. B. Z22-322. C. Z16-11. D. Z22-322. Z16-11. Answer B. Z22-322. This question differentiates between active MRSA infection, resistance, and MRSA colonization. The crucial phrase is screened for MRSA colonization and test result is positive, but does not have an active infection. Z22-322 is the specific code for carrier of methicillin-resistant Staphylococcus aureus. A 49-02 is for active MRSA infection, and Z16-11 is for resistance to methicillin, which is different from colonization. When a patient is simply a carrier without active disease, a Z-code indicating carrier status is appropriate. Always distinguish between an active infection, being a carrier, and simply having antibiotic resistance when coding these conditions. Question 13. A patient presents with a fever of unknown origin. After thorough investigation, it is determined to be due to viral infection. I. R50 9B 34 9. B. B34 9 R50 9. C. B34 9. D. R50 9. Answer C. B34-9. This question evaluates the principle of coding a definitive diagnosis over a symptom. The initial presentation was a fever of unknown origin, R59. However, the crucial phrase "after thorough investigation," it is determined to be due to viral infection, indicates that a definitive cause has been found. Once the underlying cause of a symptom is identified, the definitive diagnosis, in this case, viral infection, unspecified, B34-9, is coded as the primary reason for the encounter, and the symptom code, R59, is no longer reported unless the fever is a significant additional problem or specific guideline applies. Always code the confirmed underlying condition rather than the symptom that led to its discovery. Question 14. A patient is exposed to tuberculosis but has not developed the disease and tests negative. I. Z21. B. Z22-81. C. A15-9. D. Z11-1. Answer: I. Z21. This question tests your understanding of coding for exposure to infectious diseases. The key information is exposed to tuberculosis, but has not developed the disease and tests negative. This scenario perfectly describes exposure without actual infection or carrier status. Z21 is the correct code for contact with and exposure to tuberculosis. Z22-81 is for latent TB, a carrier, and A15-9 is for active tuberculosis. Remember that Z-codes for exposure are used when there's contact with a communicable disease but no evidence of infection. Question 15. A patient has a history of infectious mononucleosis, mono, from 10 years ago with no current symptoms or complications. I. B27-90. B. Z86-19. C. B94-8. D. Z22-89. Answer: B. Z86-19. This question assesses how to code a personal history of a resolved infectious disease. The key clues are history of infectious mononucleosis from 10 years ago and no current symptoms or complications. This indicates a personal history of a fully resolved condition, not a current active infection, B27-90, or sequelae, B94-8. Z86-19 is the appropriate code for personal history of other infectious and parasitic diseases. When a patient no longer has an active infection and is not experiencing any lingering effects, sequelae, use a personal history Z-code. Question 16. A patient is admitted for treatment of recurrent oral herpes simplex. I. B002. B. B009. C. B0089. D. B001. Answer: D. B001. This question focuses on specific types of herpes simplex infections. The keyword oral herpes simplex clearly points to a specific anatomical site. B001 is the correct code for herpes viral vesicular dermatitis, which includes oral herpes simplex lesions like cold sores. B002 is for herpes viral gingivostomatitis and pharyngotonsillitis, and B009 is for unspecified herpes viral infection. Always select the most specific code that accurately reflects the documented location or type of herpes infection. Question 17. A patient has a wound infection due to Pseudomonas aeruginosa. I. L089. B. A49-8. C. A49-8 L089. D. B96-5 L089. Answer: D. B96-5 L089. This question tests the coding of bacterial infections that are the cause of conditions classified elsewhere. The key information is wound infection, L089, unspecified local infection of the skin and subcutaneous tissue, and due to Pseudomonas aeruginosa, B96-5. When a bacterial infection is responsible for a condition that has its own code outside of Chapter 1, the organism code from Chapter 1 is typically used as an additional code to identify the infectious agent. Therefore, L089 for the wound infection is coded first, followed by B96-5 to identify the specific bacterial cause. Remember to code the manifestation first, then the organism, when the organism is the etiology of a condition classified in another chapter. Question 18. A patient is diagnosed with Kaposi's sarcoma associated with HIV. I. B20, C46, 0. B. C46, 0, B20. C. B20. D. C46, 0. Answer, I. B20, C46, 0. This question reinforces the sequencing rules for HIV and its associated conditions. The keywords are Kaposi's sarcoma and associated with HIV. Kaposi's sarcoma, C46, 0, is a common opportunistic malignancy in patients with symptomatic HIV disease. According to ICD-10-CM guidelines, when a patient has HIV disease B20 and develops an HIV-related condition, B20 is always sequenced first, followed by the code for the related condition. Here, B20 comes before C46, 0. Always remember to prioritize the B20 code when HIV is symptomatic and causing related conditions. Question 19. A patient is treated for acute cystitis due to Enterococcus faecalis. I. N3000. B. N3000. B95, 2. C. B95, 2, N3000. D. N39, 0. B95, 2. Answer, B. N3000. B95, 2. This question assesses how to code a bacterial infection causing a condition classified in another chapter. The key terms are acute cystitis, N3000 from the genitourinary chapter, and due to Enterococcus faecalis, B95, 2, a Chapter 1 code for an infectious agent. According to coding guidelines, when a bacterial infection is the cause of a condition classified outside Chapter 1, the code for the condition, N3000, is sequenced first, followed by the additional code to identify the infectious organism, B95, 2. Remember to code the manifestation first, and then the bacteria when the bacteria is the specific cause of a condition located in a different chapter. Question 20. A patient has a fever and headache due to West Nile virus infection. I. A 92, 3, R59, R51. B. A 92, 3. C. R59, R51, A92, 3. D. R59, A92, 3. Answer, B. A 92, 3. This question tests the guideline of coding a definitive diagnosis over symptoms when the cause is known. The keywords are fever and headache and due to West Nile virus infection. Since the cause of the fever and headache has been definitively identified as West Nile virus infection, A92-3, only the code for the specific infection is necessary. The symptoms fever R59 and headache R51 are considered integral to the disease and are not coded separately when the underlying cause is known, unless the guidelines explicitly state otherwise or the symptoms are being treated independently. Always choose the specific diagnosis when it fully explains the presenting symptoms. Question 21. A patient is diagnosed with infectious arthritis of the right knee due to Staphylococcus aureus. I. M00061. B95, 6. B. B95, 6. M00061. C. M00061. D. A 4900 M00061. Answer, I. M00061. B95, 6. This question assesses coding for a localized infection with a specified bacterial cause when the manifestation is in another chapter. The key elements are infectious arthritis of the right knee, M00061 from the musculoskeletal chapter, and due to Staphylococcus aureus, B95, 6, the specific bacterial agent. According to coding guidelines, when a bacterial infection causes a condition classified in a different chapter, the code for the manifestation, M00061, is sequenced first, followed by an additional code from Chapter 1 to identify the organism, B95, 6. This clearly links the bacterial cause to the specific arthritis. Question 22. A patient presents with E. coli colitis. I. A 044. B. K52-9. C. A 044. K52-9. D. K52-9. A044. Answer I. A 044. This question tests whether you can correctly identify and code a specific bacterial intestinal infection. The key phrase E. coli colitis directly points to a specific infectious enteritis caused by Escherichia coli. A 044 is the specific ICD-10-CM code for other Escherichia coli infection, which includes E. coli colitis. It is not necessary to use an additional code for the type of bacteria, like B9620 for E. coli as the cause of diseases classified elsewhere, because A044 already specifies E. coli as the causative agent for this type of enteritis. Always look for the most specific single code that fully describes the condition, including the organism, if available. Question 23. A patient has a current active recurrent genital herpes simplex infection. I. A 60-00. B. A 60-01. C. B00-89. D. A 60-00. B00-89. Answer B. A 60-01. This question requires precise coding for genital herpes simplex. The keywords are current active and recurrent genital herpes simplex infection. A 60-01 is the specific code for recurrent herpes viral infection of genital organs and urogenital tract. A 60-00 is for unspecified genital herpes, which would be less specific. When documentation indicates a recurrent episode of a specific infection, ensure you select the code that reflects both the site and the recurrence. Question 24. A patient is diagnosed with a urinary tract infection, UTI, due to an unspecified gram-negative organism. I. N39-0. B96-89. B. N39-0. C. N39-0. B96-4. D. N39-0. B96-81. Answer C. N39-0. B96-4. This question assesses coding for a localized infection with an identified, though general, bacterial cause. The core elements are urinary tract infection, UTI, and N39-0 from the genitourinary chapter, and due to an unspecified gram-negative organism, B96-4, the general type of bacteria. Similar to other secondary organism coding, N39-0 for the UTI is coded first, followed by B96-4 to specify the general type of gram-negative bacterial agent. You should add the organism code when the organism is known, even if not fully specific, and it's causing a condition classified elsewhere. Question 25. A patient has a post-streptococcal glomerulonephritis. I. N000. B95-5. B. B95-5. N000. C. N000. D. B95-5. Answer C. N000. This question tests the coding of conditions that are specifically defined as post-infectious manifestations. The key phrase, post-streptococcal glomerulonephritis, is a complete and specific diagnosis. N000 is the specific code for acute post-infectious glomerulonephritis, which inherently includes the streptococcal etiology. In cases like this, where the condition code itself implies the infectious origin, G, post-streptococcal, an additional code for the streptococcus, like B95-5, is usually not necessary unless specifically instructed by a use additional code note. Always check if the specific diagnosis already fully encapsulates the infectious etiology. Question 26. A patient is seen for exposure to a highly contagious viral infection, such as Ebola, but shows no symptoms and tests negative. I. Z20-89. B. Z29. C. A 98-4. D. Z11-6. Answer I. Z20-89. This question focuses on coding for exposure to specific infectious diseases. The crucial information is exposure to a highly contagious viral infection, such as Ebola, but shows no symptoms and tests negative. This fits the definition of contact with and exposure to other communicable diseases. Z2089 is the correct code for contact with and exposure to other communicable diseases, which would include Ebola. Z29 is for unspecified communicable disease exposure, and A98-4 is for active Ebola virus disease. Always choose the most specific Z code for exposure when the specific type of disease is mentioned. Question 27. A patient has a history of Mycobacterium avium complex, MACI, infection, which has been successfully treated and resolved years ago. I. A31-0. B. B98. C. Z86-19. D. Z22-89. Answer C. Z86-19. This question assesses how to code a personal history of a resolved bacterial infection. The key phrase, history of Mycobacterium avium complex, MACI, infection, and successfully treated and resolved years ago, indicates that there is no current active infection, A31-0, or sequela, B98. Therefore, the appropriate code is Z86-19 for personal history of other infectious and parasitic diseases. When an infection is completely resolved and leaves no lasting effects, use a personal history code to document this past medical event. Question 28. A patient is diagnosed with enterovirus infection with meningitis. I. B34-9, G039. B. G039, B34-9. C. A87-9, G039. D. G039, B97-10. Answer D. G039, B97-10. This question tests the coding of viral infections when a specific virus causes a condition classified in another chapter. The important information is enterovirus infection with meningitis. Meningitis, G039, is classified in the nervous system chapter, and the enterovirus, B97-10, is the specific viral agent. According to coding guidelines, when a virus is identified as the cause of a condition classified outside of Chapter 1, the code for the manifestation, meningitis, G039, is sequenced first, followed by the specific virus code, B97-10. Remember to code the condition caused by the virus first, then the specific virus, unless specific index entries or guidelines state otherwise for that particular disease. Question 29. A patient is diagnosed with chickenpox, varicella, complicated by varicella pneumonia. I. B012. B. B019. C. J17. D. B010. Answer I. B012. This question assesses coding for a viral infection with a specific manifestation. The keywords are chickenpox, varicella, and complicated by varicella pneumonia. B012 is the specific ICD-10-CM code for varicella with pneumonia. It explicitly captures both the chickenpox infection and the associated pneumonia. Using B019 for unspecified varicella or J17 for pneumonia in infectious diseases classified elsewhere would not be as specific or accurate. Always choose the single most specific code that describes the infection and its documented complications when available. Question 30. A patient is a known carrier of hepatitis C virus, currently asymptomatic. I. B18-2. B. Z22-52. C. B19-20. D. Z21. Answer B. Z22-52. This question tests the coding of carrier status for a viral infection. The key phrases are known carrier of hepatitis C virus and currently asymptomatic. This indicates that the patient harbors the virus but does not have active disease symptoms. Z22-52 is the specific code for carrier of viral hepatitis C. B18-2 is for chronic viral hepatitis C. which implies active disease, and B19-20 is for unspecified viral hepatitis C without delta agent, also implying active disease. When the patient is simply a carrier and asymptomatic, a Z code for carrier status is the appropriate choice.